So this is a nice switch from complementary medicine to better living with chemistry, talking about adult ADHD and its treatment. How many of you get patients who come in and say, well, you know, doc, I just found out last week I have ADHD, and I think Adderall is the one that will work best for me? Raise your hands. All right, yes, that's what I thought. So I will focus most of my attention on diagnosing ADHD. I'll talk very little towards the end about the treatment part of it. No relevant financial relationships. I will be talking about tricyclic agents and bupropion as medication options that are not FDA approved, but have been shown to have some benefit in treating ADHD. So, looking at the diagnostic criteria for ADHD, it's of course a persistent pattern. So that's an important word there. It's an operational word, that the symptoms should not be transitory. They should not be in a particular situation or in a particular circumstance. They should be persistent. Pattern of inattention, hyperactivity, or impulsivity. 6 symptoms, either or, of inattention or hyperactivity. So ADHD can be inattentive type, it can be hyperactive type, or it can be combined type. If there are only inattention symptoms, 6 of them, then it is ADHD inattentive type. If they're mainly hyperactivity, impulsivity symptoms, it's ADHD hyperactivity. And if there are 6 of each, then it's a combined type. Symptoms have to be present before the age of 12. So as we understand about ADHD now, it's a neurodevelopmental illness. And this is a change in DSM-5 that we have moved from 7 years to 12 years because it was hard to identify symptoms at such a young age. How many of you have kids? How many of you think their kids are or were hyperactive, right? So that was a challenge, and they've moved it to 12 years. Symptoms should be present in 2 or more settings. So if a kid is mainly having trouble at school, but is perfectly fine at home, does his homework, no behavioral issues, or for adults, if challenges are only at a workplace, especially under certain circumstances at workplace, but not in other settings, that is perhaps not ADHD. Then there should be clear evidence that the symptoms are severe enough to affect functioning. Now that's interesting. So let's spend a few minutes on that. Let's think of a scenario. Let's have all the people in this room run a 100-meter race, okay? So I'm sure some of you are athletes. You will run that 100-meter race in 20 seconds or